Today, I'm so happy to welcome my special guest, Jenny Hegland. Jenny currently serves as the executive director of the Good Listening Project. Her life's work centers around community engagement and healing, participatory leadership, and transformational change. Jenny's background includes experience in higher education, nonprofit startups, leadership and organizational consulting, and grassroots organizing for social justice. She holds an MS in counseling, a BS in communications, and a certificate in appreciative inquiry for positive business and society change. And today we'll be talking all about the Good Listening Project, and you can go to goodlistening.org to learn more about it. So, Jenny, welcome and thanks for joining me today.
Thanks, Karen.
I've been so excited to have this conversation about the Good Listening Project. And I wanted to mention that I learned about it from Dr. Kevin Dieter, who I interviewed a couple of months ago. And he told me how powerful the project was. And he's now joined the movement and learning to be a poet. And so I was so excited to be able to just share this with our listeners because I think it's really relevant to when we're talking about people at the end of life or people dealing with grief to learn about the power of listening.
Yeah, absolutely. And Kevin is so wonderful. And he's a certified listener poet with our community. So, really grateful to him for making the connection.
Yes, yes, I'm really grateful too. And I thought maybe we should just start out by explaining what the Good Listening Project is and how it first got started so people have that in mind before we go on to tell more about your
Yeah,
story.
sure. I'd love to tell you more and a little bit about our origin story. So, the Good Listening Project is a team of listener poets, and our mission is humanizing healthcare through the healing power of poetry and compassionate presence. So, listener poets are trained professional poets and listeners who sit down with people one on one and ask them what they would like to have a poem about. These conversations are usually only about 20 minutes. And in that time, we listen, we inquire if we have more questions, we seek to understand, and we just really try to connect heart to heart with the other person who's sharing with us. And after that short conversation, what we do is we go away and we kind of metabolize or process what's been shared with us, and we create a custom poem along with a origin story for that poem. So the origin story is just a short prose piece that gives context for the poem because they're all published anonymously. So for people who weren't in that intimate one-on-one conversation, it just gives a little bit more background of how that poem came to be and how it was co-created. And then the poem is sent to the person that we wrote it for. And I should mention that we call those people we serve poemies. So our
Poemies.
listener poets, yeah, our listener poets are the ones who write the poems, but our poemies are the ones whose stories inspire the poems. And in that way, they're co-created.
It's just such a lovely idea. And I'm curious to know how did this get started?
Yes. Well, shout out to our amazing co-founders, Frankie Aberland and Kay McKean. So Frankie was actually working at Johns Hopkins when he started this work. He was actually doing typewriter poetry, street poetry, and the National Mall in Washington, D.C. I was living there at the time as well. And his boss said to him when he found out he was doing this in the National Mall, you should come and do this at the hospital. And so that's how we got our origin coming into a healthcare setting. And Frankie right away recognized that the real essence, the value, the magic that he was offering people was that sacred space of listening. So that's always kind of been the root that the poetry is kind of this artifact, this mirror, this reflection, that someone was heard, but the listening and the heart to heart connection is really the essence of what we're trying to give people. So that's how we got our connections in healthcare. We started there, and since then we've worked with probably more than 50 healthcare organizations from small to large all across the country. And actually, we have listener poets in other countries now as well.
Wow. And I think Kevin learned about you because he was attending a medical conference where some of the doctors were poemies and the poet listeners wrote poems for them, which they then read at the conference. And Kevin got to experience it. And it sounds like fell in love with this whole process.
Yeah, right. And I think that it's experiencing the process is really the best way to kind of understand what it is. And so that's why I invited you to experience a listener poet session before we recorded this podcast. So I don't know if now would feel like a good time, but I'd love for you to share a little bit about your experience as a poemee, as the person who had your story captured through a poem, and maybe share your poem with us if you feel comfortable doing that.
Sure. Yeah, I'm really happy to do it. And I was kind of honored to have this chance to take part in it. And so my listener poet was Lee Finnegan Hosey. And she's amazing. And we did it over Zoom, which I imagine most of these sessions are probably over Zoom because people
Mostly.
don't necessarily live in the same place. And yet it was so intimate and so touching to just have someone listening so deeply to the story I wanted to tell and asking such good questions, which showed me she was hearing it and really processing what I was saying. And so I guess I can tell you a bit about the story, which was the story I told her was the very first experience I had in medical training of a patient dying, which was a 16-year-old girl in the emergency room, and how traumatic it was for me at the time as kind of an idealistic student who sort of believed that in medicine we're there to save people. We save lives. That's why I wanted to be a doctor, to save lives. And so this patient who was not very much younger than me had been injured in an auto accident, and we did an all-out trauma response and were unable to save her. And it was very shocking to me, very upsetting to be the very first death I ever witnessed, and yet no one was there to talk to me about it. There was no one around me who even had the time or a moment to stop and say, let's just review what just happened and what
Yeah.
emotions you might be feeling right now. So I had to bottle that all up and just carry it with me through the day. And I think it kind of impacted my whole medical career and training in a way, and made me really passionate about the idea that we need to do a better job of teaching people what death and dying are all about when they're first entering the medical profession. So anyway, I told Lee the story, and
Mm.
then she listened so deeply. She cared so much, had so much compassion for that moment, which was so long ago now in my life, and so much has happened
Yeah.
since then. And yet I still remember it vividly.
Yeah.
And then the poem she wrote is just beautiful. So I'll go ahead and read it. Actually, it's my
Please. Thank
podcast.
you so much for sharing it with us. This is amazing.
I can give myself permission to read the
Yes.
poem.
Yes.
It's called The House Medicine Built, and it's written after the poem The Guest House by Rumi, which it turns out is one of my very favorite poems. So I love it that Lee chose that as an inspiration. So
Did you mention that or
no, she
you didn't
didn't
know that?
know
Okay.
that. She didn't know that, but it was like this perfect synchronicity.
Oh.
So here's the poem. I live in a haunted house, every room crowded with the spectral memory of those whose earthly exits shaped me, like water etching paths through primordial rock. Here they remain, old and young, younger than should be allowed to die, slipping in and out of rooms untouched by time. Some rage like poltergeists, flipping tables, opening trap doors where last words and last looks rattle and reach and writhe, shattering every last wish I've made of medicine. More are holier ghosts. In the evening, they join us around the dinner table, swapping stories like kin of some forgotten family. And I think that while love hasn't yet healed the world, it's got real potential. Ghost or ghoul, friend or foe, I welcome them all in. No exorcism required. Each one carries a part of my story, just as I carry them in the red, red soles of my shoes.
Oh.
Yeah, so beautiful, and what a beautiful idea. I mean, I love the thought of the guest house, and of over. I mean, that death was the very first, and of course, there have been so many after my work in hospice. But to think of of the guest house and welcoming all of those people in and all of their memories in. It's really beautiful.
Oh my goodness. It brought me to tears, truly. And
Mhm. Yeah,
what a it feels so full circle. This early point in your career, and now look what you're doing and reading this story told in that way.
yeah.
Amazing. Would you mind if I asked you, like, how has this poem, it's been a little while since you received this poem. Like, how has it traveled with you? Like, how did it land in you initially, and how has it traveled with you since then?
Well, it was interesting because I think that something opened a little bit in me. One of the problems in medicine and medical training is that we're so very busy every single moment of the day. There's not time to ever sit down and process or think about anything. And so obviously this first death I witnessed stayed with me for my whole life, my whole career, and was in my mind, but I didn't realize that I still carried some pain about it until I talked about it. I just pulled it out of my memory as, a story to tell. But when I read the poem, I cried as you did. I just burst into tears when I read it, and it was like, oh, someone heard and recognized what I felt all the way back then when I was so young and just beginning to learn about death and dying and grief.
Yeah. Yeah. Oh my goodness. Just like the way you say, someone heard, someone felt my experience, and for it to be so long ago yet so alive in you is
Hmm.
just, it's remarkable. And then to hear your experience of reflecting on the power of creating space to talk about it, reflect on it. Even how long was the conversation?
Yeah, 20 minutes.
20
I mean, it
minutes,
was
right?
it was so brief, and yet, I mean, immediately you go deep because you're telling a deep story from your life to a
Yeah.
total stranger, but it doesn't feel like she's a stranger at all. It feels like because she's listening with just so intently and so carefully to every word and every detail.
Yeah. Can I ask, what was there a part of your poem in particular that stood out? Maybe a favorite part you had, or something that just really struck you?
Let me see. Um, I loved her image of everyone sitting around the dinner table swapping stories like kin. And when she wrote, I think that while love hasn't healed the world, it's got real potential. I, I love that.
Yeah, I noticed when you read that part, the joy emanated from you.
Yeah.
Like that's what I saw and felt. And I love that, right? Especially love that because those are such simple words, right? They're not like Shakespearean poetic words. They're just simple words that mean something to you. And I think that's something about poetry that often is misunderstood or can make it feel inaccessible, right? That it's somehow going to be this language that we can't connect with, or that it's somehow going to be these fancy words. But in my experience, just like you pulled that line out of the poem, some of the simplest words can convey the most profound meaning for us and be the most resonant, to more and more people.
And that's something I wanted to emphasize too is the power of poetry itself, because it's kind of distilling the story down into the simplest, briefest message using the fewest words possible. And each word though carries so much power versus if someone could just retell the story in prose, I don't think it would have this nearly the same impact.
Yeah. That's absolutely something true and right about poetry. And it's also something that does make our job as listener poets difficult, right? Because it's like our craft and our art is to discern, from all of that storytelling, what are the words that are going to capture the essence of what you shared. And not only that, but part of our practice as listener poets is around holding space And I'm sure that this is very connected to the work you do and the work any of us do with people at the end of life and people who are suffering. I mean, holding space, just being with that experience, being willing to stay there, being, accompanying. But part of holding space is also, as listener poets, what we do is we reflect on, what does this individual person in this unique moment that will never exist again in the history of time, what do they need? What are they asking for underneath the story, right? And so what I heard so much from you was, when you read it, was, she saw me, she was with me. So witnessing is part of what we can do as a space holder, but there's other things we can offer as well, and we're constantly discerning that. So I just share that as an example of, when we learn this practice and this art of deep listening, it's so much more than just hearing the words. It's so much more than just chronicling a story.
Mm-hmm.
It's feeling and sensing into, in that space holding, what does this person need in this moment? And that's why we love to say about our poems, our goal is not to craft the most impressive poem in the world. It's to craft the best poem for that person. And even you, right? If you were to tell that story on two different days, you would probably never tell it the same at two different
Mm-hmm.
times. So it's like that unique moment. I love it that it's like this archive, this capturing of that moment in that version of your story, and also what you needed to be supported in that experience, and maybe for something to move. So I love also so much when I said, how did this land with you or affect you? The first thing you said was, something opened. And
Mm-hmm.
isn't that the very definition of healing? When something moves, when emotions move, when experiences move. That's how I think of healing. So just to kind of bring it, kind of connect some of the dots of, how is this work more than just uh nice art on the side? How is it actually healing? Connecting those dots. And I'm curious, I'm reflecting this back to you about your experience, but I'm curious, like, does this resonate when I say this?
Yes, exactly. And there's this interesting synergy that happens, between the person telling the story and then the listener poet hearing it and processing it, kind of filtering it through their own words and their own vocabulary. But when the poem that comes back is such a powerful reflection of exactly what you were trying to convey by telling the story, that's just like magic. Like, that's really beautiful. And you know what just occurred to me? So at the time we did this, I've been writing all this year. I've been writing a book that it has to do with grief and guilt, and some of the guilt that we feel that in medicine as medical providers when we're not able to save a patient. And until I did this poem, I didn't realize that began at the very beginning of my medical training, that sense of failure and guilt and grief and loss, that this patient, more than anything, I wanted her to live. I wanted to be able to save her. And um and carrying that loss, carrying whatever whatever guilt we feel over, I thought we could do it, I thought we were supposed to be able to do it, and we couldn't. And having to live with that inadequacy. But I'm writing a book about that, and I had never connected what I'm writing about with that very first episode that I ended up talking to Lee about. So how perfect that that came together.
Oh my goodness. Wow, that gave me goosebumps. And I think grief, one thing that's so interesting about our work is, when we connect with people, we don't say, come in and tell us about your grief. We don't say, come in and tell us about what you're struggling with. We say, what would you like to have a poem about? And we are very intentional about leaving it open so that we can meet people where they are. I've also had people tell me incredible stories of joy and wonder and awe, and so that can come through if that's what's alive for a person. But I do want to tell you how much I think what you're writing about, this connection between grief and sort of the the shame and the guilt and in the profession of medicine right now. So personally, I've written more than 800 poems for healthcare providers and caregivers and patients all across the country in the last about 5 years. And if you had to ask me about like meta themes, like what's underneath the surface, what are people living with that they're maybe talking about in these intimate spaces, but I'm not hearing about in the more public conversations, grief is the number one thing that comes up. And it takes so many different shapes and forms. Ambiguous loss is a huge kind of grief that people are moving through and dealing with. That's something I resonate deeply with in my life as well. The death of things that aren't quite the traditional death that we think of when someone may physically still be here, but maybe their essence isn't here or something has changed, and processing that grief and loss. And so I just think that there could not be a more relevant thing to write about, not only for healthcare and medicine, but from my view for the world. Because when I look out and I see the suffering that we are creating for each other and doing unto each other, I know and I believe that it's that pain and that suffering and that grief underneath it that is what has to be healed if we're ever going to move past that.
It's
So that's why I say this is transformational work. In my experience, it is because those things are deeply connected.
it's so very true. And from my own little world of medicine, which, and I'm sure this applies in so many other areas, we're in a profession that doesn't make room for grief and doesn't even make room for death or for the so-called failure and loss when a patient dies. So there's no healthy way to process it because it's denied and ignored. It gets shoved aside. And I've always known, like, my initial grief over that patient, that 16-year-old patient, did get shoved aside then, but it stayed in the background. It stayed buried all of these years. And
Yeah.
because there was never an avenue or a vehicle to bring it out until now, until this idea of the listener poet. And I just wanted to emphasize what you're saying. You yourself are a listener poet, and probably that how you got that's how you got started in this organization.
Yeah. Oh, well, thank you for that question. And yes, I absolutely am. I serve as the executive director now, but I started out as a listener poet 6 years ago. And so we're just about 6 years old. So we're a young nonprofit. And I've been part of the team since almost the beginning. And yes, while I'm not trained as a poet, the poetry part of my craft is learned, but I am trained as a therapist. And I've always cared deeply and been fascinated by human behavior and how that connects with social change and the intersections of, the internal worlds and the external worlds. It's always fascinated me. But I never really made the connection to poetry and the arts until I learned through the art of hosting community a practice called harvesting, which was essentially in my facilitation work. How do you make meaning and learning visible in a way that can bring it alive for people and that can help people learn more deeply and that can help um, groups process and understand the complexity of what's going on? So I started playing around with visual harvesting and also then poetry as harvest. So I would listen in groups and capture key words and phrases and sentiments that were shared and then offer that back to the group as a sort of reflection or a harvest as a way of meaning making, helping the group kind of shape a collective story. And so when I met Frankie in the very early days, I was like, oh my gosh, I've done this in other contexts. And so it was natural for me to step into that listening role as someone who trained to be a listener, but for a different purpose. There really is, we have this amazing mantra that we say in our community of listener poets, which is we give the gift of staying with. There is nothing to fix.
Mm.
give the gift of staying with, there is nothing to fix. So
Wow.
this is like a whole different way of being than being in a role where our job, which is often what role physicians are in, and anyone in a healthcare role and a helping profession, is to help someone solve a problem. And often we come at that from a technical perspective rather than a humanistic perspective, right? Because the science has gotten a little disconnected from the art piece of it.
Yes.
So yeah, so that's my roots and my origin. And I also, in that story, would love to emphasize that truly anyone who feels the heart call can be a listener poet. Many people out there who've never even heard of the term listener poet probably are already listener poets. And maybe it's not poetry that's your harvest, but maybe you're making music for people. Maybe you're just reflecting words back to people in a moment, but they resonate in a way that leave people feeling like I feel felt, I feel seen. And that's what listening poetry is. And we've just formalized the practice a little bit more, but anyone who feels the heart call can do the work. And we have a course, which is actually how Kevin trained to be a listener poet, where we train people to be professional listener poets. And we are now in our 12th cohort. We have more than 85 alums. It's been going on for more than 3 years. It's a very intimate experience. We usually have no more than 10 people in a cohort, and it's absolutely an amazing community of practice that's growing globally. So we have listener poets in 34 states and 8 countries across the world right now. So yes, we are a movement. I love how you said that in the beginning of our conversation.
Yeah, what an amazing way to serve other people, and so unique and so beautiful. And I wanted to say, like, I have always longed to write poetry and then felt like I've never been able to do it. Like, I just don't have that gift. I can't write poetry. I kind of wrote it off like it's not my thing. I can't do that. And yet it sounds like if you can take a course, as you said, we're not trying to be Shakespeare or a world-renowned poet. It is how do you shape the words in a beautiful way that conveys the stories. And maybe there are just some skills that can be taught that can help people do that.
Absolutely. Absolutely. We teach the listening craft of it, but we absolutely also teach the poetry craft of it. So Ravenna Raven is our lead instructor for the course, and she has an MFA in poetry. And so there are so many people in our community, even people who are poet laureates in their cities and who are incredible published poets in our community. So we love the craft of poetry, but what we're doing is really unique in that writing for oneself is a very different craft and practice than writing for someone else in service of someone else. And so that's why even people who are experienced, published, trained poets are finding this a place that they're learning new things, because this craft of writing for others is really something different, and it requires us to tap into a different place of creativity. It's a co-creative craft and piece of art in some way. And so there's something, like you said earlier, that happens in the space between that could have never happened in any other context, right? With no different no different configuration of people. And so I love how you said that when you were talking about your experience. Our founder, Frankie, he used to say, the quality of our listening will determine the quality of someone speaking or the quality of someone sharing. So to think that as listeners in this world, we actually have the power to create the quality of sharing that other people offer, I find that so hopeful and miraculous.
Wow. And it's just so true because when you're fully present and open, and there's no judgment, there's no agenda, you're just listening. And in fact, you haven't even led the person anywhere or suggested something for them to talk about. You're just leaving the field wide open. There's just so much power in that. And it also draws the story out of the person who's telling it to feel so safe and
Mm.
so connected in that moment.
Yeah. Yeah. Some of my favorite times are if someone reflects back to me that they share something that they've never heard themselves say before or that they've never thought before. That it's like a new something new was born of that shared experience, and that gives me a lot of that makes this work very meaningful.
And do you find that that's true for the listener poets as well, that the listener poets feel changed by every story they hear and every poem they write?
Oh my gosh. Absolutely. I could tell you so many stories, but at this point, I basically trust that the universe is at play here in some
Mhm.
mysterious, magical way. And part of when we think about holding space as listener poets, actually, there's a wonderful book by Heather Plett. It's called The Art of Holding Space. And she talks about the things that really are at our back supporting us whenever we're holding space for other humans, other life. And those two things are community and mystery.
Mhm.
And they are essential for me personally. And I really lean into both of them. The community part, like when I'm holding a story that just feels like too heavy to bear, I always am reminded that like I'm not holding it alone. We have this entire community and we're holding it together, but also mystery. And for everyone, mystery is going to be something different. But for me, it's trusting that there's something bigger out there. There's a bigger force at play, and leaning into the humility of that, and also just like the absolute abundant curiosity of that. And so whenever I'm paired up, with a poemy, and I meet a stranger, I'm always in the back of my mind, I'm always thinking, what is it that I am meant to learn from this person today? And what is the lesson? What is the gem? What is the thing I need to hear as well? And I mean, there's so many stories, but I'll just tell you one that has actually resulted in a really dear, dear friendship. But someone I wrote a poem for about 5 years ago now, she was in her mid 70s and she was recovering she had just had a surgery. She had cancer, and she had also lost her husband just a couple of months prior to the surgery. And so I met her in the hospital and had a chance to talk with her, and she was full of tears,
Mhm.
so much grief. And I was just truly felt so honored to just be there and just be in this rain with her, like experience these tears with her and just hear her share. And she was sort of apologetic of her tears. I think she had felt maybe like people wanted her to stop crying. She
Mhm.
had been crying for a long time and she acknowledged that. And so I wrote her a poem that was 4 lines and 11 words. So a very short poem, which I could recite to you by heart right now. I can do that in just a moment. Um, but this woman is now a dear friend of mine. And I tell this story because I hadn't talked to her in probably 3 or 4 years, and we got reconnected after a long time after I actually stepped into the executive director role and reconnected with her. She's someone who is a huge supporter of the Good Listening Project. But that story in particular just reminds me that, like, we never know. We never know how we are touching someone else's life. So when I reconnected her with her, it was probably 3 years later after we had had one 20-minute interaction and we were in the hospital. And so I actually gave her her poem there and read it to her. And she told me that she had had that poem sitting on her kitchen table for all those years. And she
Mhm.
said every time she saw it, she thought of me and her late husband with so much love.
Oh,
But
wow.
here I am sitting on a stranger's kitchen table, um, being thought of, and it brings me to tears because it's so meaningful to think that we could offer someone 20 minutes of listening and a poem that's 4 lines and 11 words, and then provide that kind of comfort. And then it could come full circle and provide me the kind of friendship and support that I now have now in that relationship. And so I just love that story. And if you want, I could recite the poem
I'd
very,
love to
very
hear it. I
short.
have goosebumps. I'd love to hear it.
Oh, so the poem is called His Comfort. And it goes, maybe every time a tear falls, it's him softly reminding I'm never alone.
Oh, that's beautiful. Wow. I can just see why she was so comforted by that.
Yeah. And just a little, a little on the backstory. I talked earlier about, as listener poets, we listen for, what does someone need? Not in the sense of being needy, but as humans, we all have needs. What does this being in front of me need in this moment? And that poem was a little reframe, right? It was a little reframe because those tears they were holding almost a guilt, right? Like, oh, there's too many and other people aren't liking them. But what if they actually meant something different? And what if they were actually, a companion rather than something unwanted? And so sometimes just like a slight reframe like that, especially when we're so deep in grief, can just be really, really comforting. But that's not always right. It's not always right because sometimes it's right for people to hear maybe more of their exact words or more of their exact sentiments that they express. So therein lies, this discernment and this art of listening when we choose after that conversation, what do we put on that page?
Sure, but it's your own intuition, that stirs in you that says this is it. And intellectually in your rational mind, you don't really know for sure. Like, is this the right thing? You don't know, but it's because it arose in you and it was the perfect thing.
Yeah, that's where trusting the mystery comes in.
Yes, yes. Wow. It's just it's just so powerful and I feel like so much potential in this project for helping the patients that all of us are working with at the end of life or their families who are grieving and in a different way than we've ever been able to do before, offering something completely different, but that has so much meaning and power in it.
Yeah, yeah. I mean, I think the possibilities are truly endless. And maybe because you have a healthcare audience, I'll just speak briefly to, how our programs work and give a couple examples of how we're doing that now, because there's so many different ways that this can be applied. But in healthcare settings, usually what we do, the kind of the core of our programming is these one-on-one listener poet sessions. And then often we pair them with what we call small group brave conversations. So after people have had their poems written for them one-on-one from a listener poet, we bring them together in small groups of 3 to 5 people, and we facilitate a short 1 hour process where they share their poems with each other. And it's so incredibly connecting and humanizing. And the common thing that I hear, we're doing this right now with a large group of residents and fellows all across the country. We've just finished a large project with the staff of the American Cancer Society and their patient support team, focusing on why they do the work they do with the American Cancer Society. We've done with this with different health systems. So we're doing it in a lot of different contexts. But the most common thing I hear after these small group brave conversations is people are leaving feeling like I'm not alone.
Mm-hmm.
And that disconnection that so much of us experience, even though we're in the presence of all the busyness and the social media and all of the chaos of what's happening in the world, there is a deep sense of loneliness and isolation that so many people have expressed to me that they're experiencing. And these are people you would never guess that that's their experience, right? On the outside, people with very prominent roles, people who are incredible leadership positions, people who are serving others and helping so many others, right? But this experience of feeling like I'm not alone in my vulnerabilities, the particular vulnerabilities that maybe culturally there's not the spaces to talk about, that is incredibly important for resilience, for combating burnout. These are not just nice to have, these are actually scientifically proven. Like, this needs to be happening physiologically in the human body in order for people to be able to function well and for them to be able to access higher order functioning, right? Some of these basic safety, essentially the body and the psyche need to feel safe, that we need those things in order for people to be able to flourish and thrive and even just function at basic levels, honestly.
Mm.
So those small group conversations are so essential. And then what we do, and this gets to where at TGLP, we're not just an arts program. We are part of creating systems change. And in healthcare, we need that systems change as much more than anywhere. We need it in a lot of places. But how is this the work of systems change? Culture changes when stories change, when collective stories change. And that's why we put together, we publish anthologies. So
Mm.
the books are stories of communities, right? Where we have the origin story paired with the poem, and we start to tell a collective group of people their stories of their humanity and
Mm.
make visible and at the forefront. So publishing these stories, the other ways we publish things is we do poetry readings. And so sometimes we publish these digitally, but this storytelling, ultimately we're serving the one person we're writing for, but the ripples of these poems and these stories can have so much more impact. We are super passionate about writing for people whose voices are marginalized. So, for example, this anthology right here is called Amplifying Voices of Black Women Physicians in OBGYN Residency Programs. So,
Mm.
specifically, the unique experiences of Black women in this field, because there is such um, a disparity in how Black women are experiencing health outcomes and around all different areas of health, right? And so, like that, those stories need to be amplified, but trying to come at that from the cognitive perspective and from the scientific perspective and from the data perspective is important, but it's not going to get us where we need to go because that doesn't change people's hearts.
Exactly.
People's hearts. Yeah.
Exactly. Wow, I can just feel the power of those small group listening sessions because I mean as much as it is powerful when you tell your story to one person and read the poem they wrote for you, to hear other people's poems and stories as well, and to see yourself in all of their stories and their poems and what you've experienced and how connected we all are. um, we don't get to see that very often. I mean, we're confronted every day with how different we are than other people. But if we honestly could see how deeply connected we all are, that would truly change everything.
Nailed it. Yeah, you nailed it.
Yeah. Wow. This is uh I'm just feeling so inspired that of course now I have to become a listener poet.
Oh my gosh,
How
Karen,
could
that'd
I
be
not?
oh,
But
oh my,
I do want to ask about that when someone becomes a listener poet, what are they signing up for and what does it involve and what are the like responsibilities, I guess, of doing that?
yeah. So people take the course for many different reasons, and people come from all walks of life. So we have a lot, I would say at least half of the people, half of our alums at this point, our community are actually people working in healthcare. So they're social workers, they're chaplains, they're physicians, they're nurses, they're medical educators. We have a lot of people working in medical education. They're in hospice. Hospice and palliative care is an area where we have deep, deep connection because there's just so much alignment in terms of the values. And so I think that's probably why, we connect. It just makes so much
Yeah.
sense that we would connect like this. And so there are certain areas within healthcare, but we've also had people who take the course, who actually work in the banking industry, and people who work in education. I mentioned we've had a lot of writers and poets, and those people are coming to us saying, I want to use my gifts in service of something bigger than myself.
Mm.
This is a place for them to do that. And the people from the healthcare side are saying, I want to bring the humanity back to healthcare. I want to bring the relationships back to the center of healthcare. I want to bring the artistic and the creative. I want to turn that right side of my brain back on because it was trained out of me in medical school and for the past 20 years that I've been practicing, right? So there's these different reasons, but at the intersection of this listening and poetry and healthcare and systems change, really, and transformation, is an incredible community of people who find themselves there for different reasons, but there's deep resonance about that. And so what we do is we take those people through a shared journey together. We have different formats. So we're actually going to be experimenting with a 1 week accelerated version of the course coming up in next January. But so far, we've offered the course in sort of 8 weeks of coursework plus a month practicum, or 5 weeks of coursework plus a month practicum. And in the coursework, people in the cohort are connecting deeply with each other. We go through a whole curriculum. It's very relationally based. It's very intimate. The group gets very close. There's deep friendships that are made. And then that practicum is where each person chooses 6 people in their community whose voices they want to capture through poetry. And so they do a practicum, which becomes their own mini collection of stories,
Mm.
and they get that practice as a listener poet. And then after they graduate as a certified listener poet, we have an ongoing community of practice so people can stay connected. But from there, people can really do a variety of different things. So a lot of people will take what they've learned and they'll integrate it back into the work that they're already doing. So
Mm.
we have the coolest stories of this practice getting integrated into the curriculum of medical schools, getting integrated into different programming and community settings, getting integrated into research. We actually have a lot of public health researchers and community-based researchers that are using this in addition to focus group type methodology. And so there's so many ways that people are integrating it into their practices. We have people who are doing research and also publishing research that's going to be coming out. But also we then bring our listener poets on to work as contractors for the projects that the Good Listening Project has. So formally, so a lot of the listener poets, I think it's 12 or 13 at this point, come and contribute to the various projects that we have. So for example, we've been working on a partnership with Memorial Sloan Kettering over the past year and a half, where we've been writing poems for hospice patients who are LGBTQ plus, and a nurse practitioner is actually delivering something called dignity therapy at the end of this person's life. But instead of receiving the transcript back, they receive a poem and origin story written by a listener poet. So it's an innovation on the traditional dignity therapy delivery.
Wow.
And so we have listener poets, alums work on projects like that. And so many of those patients have told us after receiving the poems that they've already planned for those poems to be read at their celebrations of life, or, whatever they plan to have happen after they
Mm.
die. And I mean, I could go on and on about how
Wow.
meaningful that is, but
Wow.
it's basically all these projects we invite listener poets to be a part of. And then we also say, if you have a dream, we want to support that. So Hysteriography is a collection by Dr. Julia McDonald, who graduated from 2 cohorts ago, and is all poems about uteruses and people's experiences with uteruses and pregnancy and menstruation and puberty and all kinds of things that we never talk about, right? And so things like if a listener poet has a dream, our goal is to help bring that dream to life. So I
Mm.
like to say everything is possible for listener poets. And because we're so young, we're still finding the way together. So it's all collaborative. It's all in the spirit of co-creation.
Yeah, so someone who already has their practice as a death doula or a funeral
Yes.
guide could learn to be a listener poet and then utilize it in the work they're already doing, or someone working in hospice or palliative care.
Yes.
And
And we have so
and
many people doing that already. Yep.
so okay. Oh, wow. So the possibilities really are endless then to look at it that way. And I hope that people are getting the message and seeing the point that this is just such a powerful tool that could be used to really help people and help families. And I'm just thinking of the beauty of a family being able to keep the poem that was written for their loved one and to cherish that and even to keep reading it every year at anniversary celebrations and how what a lovely legacy and keepsake that would be.
Yeah. Oh my goodness. Yeah. And I also want to say that it's not just a one-time thing too. Like, for example, we have a program for caregivers that's called Caregiver Haven. And not all of our programs are available just to anyone because unfortunately we don't yet have the funding to support that. But one program that we do have that's available to anyone who identifies as an informal caregiver um, and go to our website and sign up for a listener poet session. And you could do this more than once. When we're doing this with residents, we're actually doing this multiple times throughout their training because things change and this
Mhm.
gives them a chance to see their own experience at different points. And so, this is something that can not only be of service to people once, but also can meet people in different moments in life. And I think just to touch on caregivers for a moment, this is an area that as an organization we're really passionate about. The burden of caregiving is tremendous.
Mhm.
And the more difficult the system gets to navigate, the harder that gets for caregivers. And there are millions of caregivers across our country, and so much of this work goes unseen and is unpaid and is invisible in so many ways and takes so much of a toll on people. And so we are here to support caregivers. And we're also really excited to be doing collections in the future that really capture caregiver stories. So if you or anyone you know who's listening is an informal caregiver and this sounds interesting to you, you can go to goodlistening.org and click on Caregiver Haven, and we'd be delighted to write a poem for you.
Mm. And I think we should emphasize there's no charge for the poemies who have the
That's right.
poem written. You can accept donations if someone's inclined to do that, but there's no charge. So um, so it's truly a work of love, a service from the heart.
It is, that's right. And I should clarify that when we deliver our programs to organizations, there is a charge for them for us to deliver that programming, but the poemies, the people who we're writing for, there is no charge to them. So either we have donor funding where we can make programs available like Caregiver Haven, or we work with partners or we work with grantors who can fund programs so that we can make programming available to different groups of people. Another group that we have kind of open availability for right now is any medical resident or fellow across the country through a partnership that we have with the Kern National Network for Flourishing and Health. They're an amazing organization and really committed to supporting graduate medical education. We know that that's a crazy time in physicians training, and there's so much going on. Their stories are incredibly inspiring. So if you are in a physician in training, a resident or a fellow, you can also go to our website and sign up for that as well. So, but yes, our we want to make and we do everything we can to make this program available at no cost to the people that we're serving directly.
Okay. And so people can find out everything they need to know at goodlistener.org.
It's good listening.
Good listening. Okay,
Yep. Yes,
goodlistening.org. Got to
that's
get
right.
that right for sure.
Yep.
Good listening. And it is indeed good listening. I mean, I think that's what we all strive to be able to do. We just for the people we love and people in our lives to do good listening so that we can really connect from the heart.
Thank you. Yeah. Thank you so much.
Well, I just really appreciate you being here, Jenny. It's so much fun to talk to you. I feel like this in itself has been a good listening project
Oh,
to
that one
to
more.
talk with one another. And thank you so much for giving me the opportunity to be a poemee and to have a poem written for me. It was just very powerful, and it makes this, um, all the more real to be able to present it and tell other people about it.
Yeah. Thank you so much, Karen. Thank you for the work you're doing. And I think that there's so much opportunity for us to integrate this with end of life experiences and being part of contributing to making that quality quality living while dying. Like that's something that we so want to be a part of. And I would be remiss if I did not mention this as inspiration because so much of your community works in this world of accompanying people near the end of life. There is a poet and spoken word artist named Andrea Gibson. Are you
Mhm.
familiar with their work?
Yes, yes.
So Andrea just died recently from cancer, and their work in throughout their career, but especially in the last 5 years of their life when they were living with cancer, is some of the most moving, profound poetry and storytelling and meaning making and spiritual inspiration that ever I have ever had the joy of taking in. And so I encourage anyone who is finding this poetry thing interesting, if you haven't checked out Andrea Gibson's work and learned about their life and been touched by their poetry, I really encourage you to do that. There's a poem in particular that I thought about reading if we had enough time, but I can just mention the name of it. It was actually published by Andrea's partner after they died.
Mm.
And this poem is called When Death Came to Visit. And
Mm.
it's just an exquisite, exquisite poem.
Do you want to read it? I mean, that might be a good way to close. I don't want to
I
miss it.
would, I would love to. So it'll probably take me maybe about 3 minutes. So it's a little on the longer side, but it would be an absolute honor to read this poem as a way of closing.
I would love that as well. But
All right.
mhm.
So this poem again is by Andrea Gibson. It's called When Death Came to Visit. When death first came to visit, I refused to let her enter my home. She sat outside in the garden picking buttercups, painting her face the color of the sun. I stood at the window for hours watching her, thinking, why is she still here? It's not like she has nowhere to go. I'd try to sleep, but as soon as I closed my eyes, I would hear her outside talking daisies into blooming at night. I suspect she knew. I too am the type to open my petals for the moon. On my 8th night awake, I did it. I don't know how, but I did it. I walked out to the garden and invited her in. I poured her a cup of lavender tea. I made up her bed and turned down the lights. I wished her good dreams, though I knew her good dream was to one day take my life. I used to believe I knew my purpose, thought for sure I understood my calling. But my calling, I know now, has always been this: to parent my own departure, to never punish the child for being who she is, to keep a roof over the head of the truth, to raise what will end me with love. Now, people often ask how it feels raising a delinquent, a child capable of such awful behavior. But what rule has she ever broken besides the ones we make up in our minds? Ask me instead how it feels to raise a genius, a child with a boundless IQ. She could get away with anything, yes. She could get away with me any minute, but I trust her. I have to. I see some of the letters on a chart on a wall. She has infinity vision. Besides, who would I be if I were someone who would say, I'm going to ground you for wanting to heaven me? I don't want that ever. It doesn't matter if I made her with my body or not. She's mine. I owe her a stable home. I owe her an allowance without the stipulation that she use it to buy me more time. At night, when I tuck her in, I read her a story with the same 3 words on every page. You are innocent. You are innocent. You are innocent, I say. Before I close the book, she asks, but have you ever known anyone who is so unwanted? It's the saddest question in the universe, and she asks it every time. People don't know you, I say. They'll want you when they meet you, won't they? She says yes, looking me dead in the eye. And you, she adds, you're really okay with who I want to be when I grow up? I know I have to answer honestly. I say, I don't want you to grow up too fast. You know that. You know I can't help but be one of those parents who wishes their child could stay a child forever. It's only because I've cherished these years so much. But when you're ready, I'll be ready, I promise. I've committed the rest of my days to learning how to give you my blessing when it's time for you to follow your dreams. I know it's how you say, I love you. I know others will hear it as a curse and try to rinse your mouth out with soap. But I will hear your I love you. I will hear it so clearly. My last words will be, I love you too, as I watch you make something of yourself, as I open my petals for the moon.
Oh, wow. That's incredible. Thank you for sharing that.
I mean, the genius of using a small girl child as personification of death and how that can change perspective. I mean, that is the power. That is the power of metaphor and poetry right there. And
Oh,
genius
wow.
of Andrew Gibbs.
That's just stunning. So stunning. And all of their poetry is of similar quality that I've read, everything that I've seen. Amazing. Oh, wow. Thank you so much for sharing that. So I'll just remind listeners that I'm talking with Jenny Hegland of the Good Listening Project, goodlistening.org. And this has just been an amazing time together, Jenny. Thank you so much.
Thank you. And I am so grateful that you shared your story and your experience and your poem with us. I think that I'm sure people listening to you, some may know you, some may not, but I'm sure that they'll feel they know you better after hearing that story. So thanks for having the courage also to share that and for lifting up this work. We're so excited about the healing potential of it and hope we can stay connected and spread
I,
this as far and wide as we can.
we will, I'm sure. So take care. Okay.
Thanks.